So nurse informatician can work in different side of the healthcare, but I work under the pharmacy. I sit under the pharmacy side of it. So I would do anything medication side. For example, EPMA, which is our electronic prescribing medication administration system. We have the automated dispensing system. Well, mind you, there is also an automated dispensing system for the pharmacy, which is literally the robot. And then we have the nursing side of it, which is you have Omicel or Pixis in other trusts. And we also have other systems. We have an inbuilt ordering system that our trust built, and has to do with medication ordering. And so that's something that we work as a team, right? And we all have our strong what we are very good at. For example, I'm very good at uh, digital locks. You've seen videos I've done. I'm programming these digital locks. Mind you, you don't have to learn all of this. You don't have to know all of this to be employed. I learned this in the job. You get it. Um, so my trust is trying to get into a new system, which is a very big project. So getting one system in place is going to improve patient care and also make it easy for nurse. One of the exciting things I've been working on this week was to come up with a guide to be able to access a disaster recovery computer for one of the ward. And this disaster recovery PC is in case EPMA doesn't work. We have a system in place that you can go and print out a prescription chart. So I am in charge of giving out training to staff. So I have in mind to give a PowerPoint presentation to the ward sisters and to the nurse. Training. I did a medicine safety training to a group of uh, clinician, consultant, doctors, nurses, and this is just mainly to point out, you know, things they should be aware about the system, because the system is there to help us, but it's not like perfect. It does have its own. It comes with its own drawback. So this training is to point out those drawbacks. So, like I said, my trust is getting to a new system. So we have this portal in place, and we day-to-day basis we have to play with it and just identify problems that can come up with potential problems. So I was interested to look at the outpatient side of it. And guys, that's why I keep telling you guys to do shifts elsewhere, because the way you would think will be different. What do I mean by that? I was faced with a situation where I forgotten what the question was, and the answer I was given was from the emerg because I've done extra shift in the emergency ED and in medical ward. So the answer I was given was in respect to ED, the experience I've had in ED and in the medical ward. I wasn't looking at it in the surgical side of it. But then that should not be a bad thing, because that is why big projects like that we involve many people from um you know um every specialty. But it's just to point out to you why you need to do extra shifts in other words. So with me playing around with the system, and looking at the outpatient, how nurses will get into the system to administer medication, I identify a problem, and I flagged it up to our clinical safety officer. And then another thing I did this week was attend a meeting on, what we could do to mitigate this risk we identified. So in this meeting, we have people from all background who come and figure out what to do, and we also have a system supplier who is Cerner in this meeting, and we'll point out the risk we identify, and then we come up with mitigation. The mitigation strategy could be to put up something new on the system. It could also be training, just training or making people aware. I've heard a lot of people reach out to me. How did you get there? How did you do it? What should I learn? And I will tell you the best answer is nowhere to look for this job, because in looking for this job and identifying the job specification, person specification, you will know what to study, because most of this job will be like training qualification, teaching qualification, um, project experience or project management knowledge, um, mentorship qualification. You'll see it pointed out there. I don't want to be the one to tell you, go and study this. Meanwhile, you're very much qualified, because the truth is, if you have a word experience, if you have acute care experience, you are qualified. And some of you are way more qualified. And I don't want to tell you to go and do something that is most of the time is a desirable criteria, not the essential criteria. So if you get to me, I'm happy to support you. But in case you're not planning to get to me, the best answer I'm going to tell you is study job description. Look, go out there and start applying. Yes, with the experience you have, go and start applying, and trying to meet with those qualifications that they are requiring. Yeah, I have a starting pack, so you can always reach out to me, and I'm always very willing to help. If I don't reach out to you urgently, immediately, I would definitely reach out to you.